Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. Following a gastric resection, a 70-year-old client is admitted to the post-anesthesia care unit. He was extubated prior to leaving the suite. On arrival at the post-anesthesia care unit, the nurse should check airway, feeling for amount of air exchange noting rate, depth, and quality of respirations. Obtain pulse and blood pressure readings noting rate and quality of pulse. Reassure the client that his surgery is over and that he is in the recovery room. Review physician's orders, administering medications as ordered. The correct answer is check airway, feeling for amount of air exchange noting rate, depth, and quality of respirations. Adequate air exchange and tissue oxygenation depend on competent respiratory function. Checking the airway is the nurse's priority action. A 19-month-old child is admitted to the hospital for surgical repair of patent ductus arteriosus. The child is being given digoxin. Prior to administering the medication, the nurse should not give the digoxin if the pulse is 60. Not give the digoxin if the pulse is 100. Take the apical pulse for a full minute. Monitor for visual disturbances, a side effect of digoxin. The correct answer is take the apical pulse for a full minute. Prior to digoxin administration in both children and adults, an apical pulse should be taken for 1 full minute. Aside from the rate per minute, the nurse should note any sudden increase or decrease in heart rate, irregular rhythm, or regularization of a chronic irregular heart rhythm. When assessing a client, the nurse notes the typical skin rash seen with systemic lupus erythematosus. Which of the following descriptions correctly describes this rash? Small round or oval reddish-brown macules scattered over the entire body. Scattered clusters of macules, papules, and vesicles over the body. Bright red appearance of the palmar surface of the hands. Reddened butterfly-shaped rash over the cheeks and nose. The correct answer is reddened butterfly-shaped rash over the cheeks and nose. The characteristic butterfly rash over the cheek and nose and into the scalp is seen with systemic lupus erythematosus. A family by court order undergoes treatment by a family therapist for child abuse. The nurse, who is the child's case manager, knows that treatment has been effective when the child is removed from the home and placed in foster care. The child's parents identify the ways in which he is different from the rest of the family. The child's father is arrested for child abuse. The child's parents can identify appropriate behaviors for children in his age group. The correct answer is the child's parents can identify appropriate behaviors for children in his age group. Identification of age-appropriate behaviors is essential to the role of parents, because misunderstanding children's normal developmental needs often contributes to abuse or neglect. A male client is scheduled to have angiography of his left leg. The nurse needs to include which of the following when preparing the client for this procedure? Validate that he is not allergic to iodine or shellfish. Instruct him to start active range of motion of his left leg immediately following the procedure. Inform him that he will not be able to eat or drink anything for 4 hours after the procedure. Inform him that vital signs will be taken every hour for 4 hours after the procedure. The correct answer is validate that he is not allergic to iodine or shellfish. Angiography, an invasive radiographic examination, involves the injection of a contrast solution, iodine, through a catheter that has been inserted into an artery. A 20-year-old client presents to the obstetrics gynecology clinic for the first time. She tells the nurse that she is pregnant and wants to start prenatal care. After collecting some initial assessment data, the nurse measures her fundal height to be at the level of the umbilicus. The nurse estimates the fetal gestational age to be approximately 10 weeks, 16 weeks, 20 weeks, 30 weeks. The correct answer is 20 weeks. At 20 weeks, the fundus is located approximately at the umbilicus. A prima gravida with a blood type A negative is at 28 weeks gestation. Today her physician has ordered a RhoGAM injection. Which statement by the client demonstrates that more teaching is needed related to this therapy? I'm getting this shot so that my baby won't develop antibodies against my blood, right? I understand that if my baby is Rh positive, I'll be getting another one of these injections. This shot should help to protect me in future pregnancies if this baby is Rh positive, like my husband. This shot will prevent me from becoming sensitized to Rh positive blood. The correct answer is I'm getting this shot so that my baby won't develop antibodies against my blood, right? RhoGAM is given to Rh negative mothers to prevent the maternal Rh immune response to fetal Rh positive antigens. A female client at 10 weeks gestation complains to her physician of slight vaginal bleeding and mild cramps. On examination, her physician determines that her cervix is closed. The client is exhibiting signs of an inevitable abortion, a threatened abortion, an incomplete abortion, a missed abortion. The correct answer is a threatened abortion. A threatened abortion is a condition in which intrauterine bleeding occurs early in pregnancy, the cervix remains undilated, and the uterine contents are not necessarily expelled. A male client is admitted to the medical surgical unit from the emergency room with a diagnosis of acute pancreatitis. The nurse performs the admission nursing assessment. He is NPO with IV fluids infusing at 100 milliliters per hour. He is experiencing excruciating abdominal pain. Based on an analysis of these data, which nursing diagnosis would receive the highest priority? Pain related to stimulation of nerve endings associated with obstruction of the pancreatic tract. Fluid volume deficit related to vomiting and nasogastric tube drainage. Knowledge deficit related to treatment regimen. Altered nutrition, less than body requirements, related to inadequate intake associated with current anorexia, nausea, vomiting, and digestive enzyme loss. The correct answer is pain related to stimulation of nerve endings associated with obstruction of the pancreatic tract. Relief of pain is the primary goal of nursing intervention because this client is experiencing acute pain. A female client has been hospitalized for several months following major abdominal surgery for a ruptured colon. A colostomy was created, and the large abdominal wound was left open and allowed to heal through granulation. She is receiving gentamicin IV for treatment of wound infection. Knowing this drug is ototoxic, the nurse would implement which of the following measures? Instruct the client to report any signs of tinnitus, dizziness, or difficulty hearing. Advise the client to discontinue the drug at the first sign of dizziness. Order audiometric testing in order to determine if hearing loss is caused by an ototoxic drug or other cause. Instruct the client in Valsalva's maneuver to equalize middle ear pressure and to prevent hearing loss. The correct answer is instruct the client to report any signs of tinnitus, dizziness, or difficulty hearing. The first nursing measure is to instruct the client in which drug side effects to report. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.